don't take that first answer for the final answer, because that's where despair comes in. And that's where hopelessness comes in. There are resources out there for you. There are grants, manufacturer assistance programs. There is something out there to assist you. So don't give up.
So I'll be brave if you're brave.
Welcome to tonight's Lung Cancer Living Room with a really important conversation tonight, and it's about enhancing access to care. So for those of you who might not be familiar with the Lung Cancer Living Room, it's a support and education series where we invite key opinion leaders to come in and talk about varying aspects of the disease. And we are incredibly grateful for this team of women from South Florida who is willing to come and talk to us tonight about some really unique, impactful programming that they have set up at Memorial Healthcare. You guys have heard us talk about Memorial historically in the past. They really are a true testament to what good looks like across the board, and this team is absolutely no exception to that. So when we talk about patient access, it really, refers to varying aspects. Patient access is a sort of an overarching umbrella that includes everything from affordability of treatment, which is what we're going to be talking about tonight, in particular, access to medication. We know that medication access doesn't necessarily impact everyone diagnosed with lung cancer, but in my very humble opinion, it affects way too many people who are denied access for various reasons to these life-extending and life-saving treatments. So before we kick off tonight, I'm going to ask each of our speakers to introduce themselves. So Claudia, do you want to go ahead and start?
Hi, everyone. My name is Claudia Theodule. I am a medication access specialist at Memorial. I've been on the team now for 6 years, but I have been a registered pharmacy technician for 18 years. My primary role on this team is to assist our oncology patients, but mostly we do both orals and infusion medications. I primarily assist our patients with getting access or gaining access to our infusion medications, so copays and free drug.
That's great. Thank you, Claudia. Cynthia, you're up next.
My name is Cynthia Montenegro. I'm a medication access specialist with the Memorial Healthcare System. I've been on the team for about 2 years now, but a pharmacy technician for 14 years. My main role on this team is that I work primarily with prior authorizations and copay assistance, whether it's infusions or oral medications for our, not just on our oncology team, it's across our system.
Thank you, Cynthia. Dominique.
Good evening, all. My name is Diamond Darville. I am a medication access specialist here with Memorial Healthcare System. I have been in this role for 4 years. I've been a pharmacy technician, a registered pharmacy technician, that is for 19 years. My role primarily, I help to support the oncology patients, but I work with patients across the system, whether they're being discharged from the hospital or just needing care for that specific disease state. My primary role consists of prior authorizations and pre-authorizations of infusion, obtaining patient assistance, that is, and helping to enroll our patients in any grants that may be available for their specific disease.
Thanks, Diamond. And Jennifer, last but not least.
Hi, everyone. My name is Jennifer. I'm the ambulatory clinical pharmacy specialist in hematology oncology. I primarily work in the outpatient setting, so I deal with all the oral medications, and my role kind of sits at the intersection between all three. So I work definitely with the medication access specialists in getting patients access to these medications. I work with the providers to make sure that clinically the medication makes sense, everything's appropriately documented and accessible so that patients get these medications without delays. And I work with the patients directly to educate them about their new medications, and I follow them through the life of the drug, checking in to make sure that they're doing okay on their therapy, and that they're feeling okay and the medication's doing what it's supposed to do.
Yeah. Thanks, you guys. So we're gonna jump into the meat of this conversation, but before we do, I just have a little comment and a sort of a personal thought. You know, having worked in this space, you know, for the last 20 years, what we have seen in the last 20 years is the lists of appropriate medications to treat lung cancer, both non-small cell and small cell, have gotten really long, right? That's the good news. Like, a lot of discovery, a lot of research has been done, and these are truly life-extending and life-saving medications. And I have spoken with folks around the country and around the world who clearly qualify for a specific medication targeted to treat their specific type of lung cancer, only to be told it's not covered and it's a $20,000, $30,000 a month, you know, medication. And so how devastating is it for that person to be told something like that and then not know where to turn to gain access? And what these beautiful women do is help navigate that process. So before we jump in, medication access challenges are also sort of multifaceted. Can you guys talk about what we mean when we say medication access? And Claudia, I'm going to turn to you for that, and then I think we're going to share a little patient story.
Especially at this time of the year where patients have deductibles to meet. Most of the patients that we get referrals for are patients that have Medicare, for example, and can't afford their copayment. And those patients are often feeling the burden of hearing, you know, hey, my deductible is $2,000 and that's the cost of my medication. And they come to us to get grants, free drug enrollment. Right now, especially for lung cancer, we're enrolling a lot of our patients into these open grants. Thankfully, these grants have opened up in the beginning of the year, and we can assist them, our Medicare patients, to afford their medication. One of our patient stories that was submitted, which was one of our patients that they had insurance, but the medication was unaffordable to them. And I tried to seek manufacturer enrollment for that patient, and they were denied because of income, which is the story that I'm about to read to you guys. The patients had a significant income, but that doesn't mean that they're able to access that medication as readily as everybody else, especially when you start to think about it from month to month. It's not just a one-time thing, which the patient explained, it's cycles. Other times, this is life or death, unfortunately. So I'd like to read one of the patient stories that was submitted for a medication called Venclexa. Her patient's wife stated her husband was fined for insurance coverage for Venclexa. 3 regimens were unsuccessful in achieving remission, so Venclexa is about $13,000 per cycle, and the physician ordered cycles, which came out to about $104,000 out of pocket. I helped the patient, or the medication access specialist helped the patient to apply for a income-based scholarship, which is the free drug assistance, which a lot of the chemotherapy drugs offer free drug assistance. Guided the patients through the whole appeals process and advocated for the patient on their behalf, because a lot of the times we have to go to bat for the patient. Their effort ultimately resulted in the receipt of the medicine free of charge. Their communication throughout the process was also outstanding. $104,000 out of pocket would have been a tremendous hardship for our family, especially with my husband on leave from his job because of the cancer treatment. We are so grateful for the support of the team during time and extreme stress, avoiding extreme stress and worry. So it's not just gaining access to free drugs. It's getting the prior authorization. It's starting from the very beginning. A lot of the times, that's part of where the problem is. Getting denied for the prior authorizations. We have to work on appealing those. And then when it's approved and we run it through the insurance, the medication through the insurance, it's getting those copays because of a deductible, and then helping the patient gain access to the medication after getting those high copays.
For a lot of us, I think, in the room, I'm not sure online, there's a little disruption in the audio there, but I think we sort of get the gist that it's, you know, access is complicated in services like this, when the person diagnosed shouldn't have to be worried about figuring out how to navigate this on their own, to be able to have a team at the ready to provide this type of service was incredibly beneficial. So, Cynthia, let's turn to you, and Claudia touched a little bit on some of the challenges, but what is the most common reason that medication is maybe denied by insurance?
Well, sometimes the medications are denied because patient hasn't met the requirements that some insurances have, whether it's they want them to try a different previous therapy, say for Farxiga, they want the patient to try a metformin before they try the medication. So sometimes it's just because of that. Maybe patient has changed insurance and they have tried the medication with their previous insurance and the new insurance is not aware. So it's the communication between that, or the patient's diagnosis is not an FDA approved diagnosis for the medication, or it's not inputted correctly. So it's just mainly going through the prior authorization process for the insurance, or it's just not a medication that's included in the insurance formulary.
Yeah, and
so it's just something that they have to consider.
Yeah, and I think one of the things some folks might or might not be familiar with is what Cynthia was talking about is this sort of step therapy option, right? Where your doctor may have prescribed X drug because he or she thinks it's what's best to treat your cancer, but the insurance company's like, yeah, well, why don't we go ahead and try this first and see if that works before we go here. And I mean, my very personal opinion is that it fundamentally, there are so many issues, again, personally, that I have with that. And one of the ways in which GoTo in particular works to try to affect change in that area. But it's a very real, challenge, again, that I think most people diagnosed don't really understand as far as what's going on there. So let's talk a little bit about what the process looks like. How does someone get from a diagnosis to a treatment plan to your team? And then once they get to your team, what does the process look like in sort of walking them through that? I think we're going to start with you, Jennifer.
Yeah. So the first step is, of course, diagnosis. Patients will either get their diagnosis through the ER and then be referred to their oncologist or through their PCP. And the first step really is, does this patient have insurance? If they have insurance, that moves us on to the next step. If they don't, at least with Memorial, we have a MHS charity that can help with these treatment plans. So the next step after that is a treatment plan. The oncologist will either decide to do IV chemo, radiation, or oral chemo, or a combination of all three. If it's oral, that's where we come in. And typically it is, along with every other therapy that they prescribe. So that oral medication comes to us and we check, okay, are they insured or are they not insured? Typically, we do something called the test claim as soon as that comes into our pharmacy. And this is, of course, in accordance with our pharmacist. So we would have, the oncology pharmacist would have that discussion with the provider. We would go back and forth about therapy, drug-drug interactions, all before this treatment plan is set in motion. And they let us know, hey, this is the treatment plan we've decided on. Is it covered? So that's the $1 million question. The test claim is done and we check, okay, is it a medication that requires a prior authorization or does it not require a prior authorization? If it doesn't, that's great. It moves on to the next step. If it does, our team, our access specialists will help and conduct that prior authorization, which of course requires several questions that insurance companies do look for, like you mentioned, to make sure that all the necessary things are hit. Is it a target? Is it a mutation that they want to see? Is it prior therapy, step therapy? So there are several things that they have to answer to make sure that this will in fact be covered. After that prior authorization is done, these take about 3 to 5 days to get approved. So it's a process. If it's approved, great. We move on to the next step and we look for any kind of copay coverage. If it's not approved, why was it not approved? They'll typically send us denial letters. It's going to tell us, hey, we prefer brand versus generic or vice versa. Does the medication require a dose adjustment? Does it require a step therapy? Are there drug-drug interactions that need to be addressed? Is that genetic mutation available for us and documented appropriately for us to see? So we go ahead and we appeal these decisions if they're denied. We do our best to make sure that everything is documented and shown so that it moves on and the appeal gets approved. Of course, there is a possibility that it doesn't, and then that moves on to a second level appeal. There are things that our access team can do to help out with this, and that is helping patients get set up with manufacturer vouchers or bridge therapy in the meantime that these appeals are getting approved, because they can take some time to get approved. On the flip side, if it does get approved, we check if they need any copay assistance. If patients need copay assistance, we look for manufacturer copay cards, we look for grants, we look for things called Medicare prescription payment plans, which splits up their payment into 12 months. So there are several things that we can look for to help patients sort of get that medication covered. And once that's done, it makes its way all the way through the process, comes to us, the pharmacists at the end, who are able to give that initial assessment and explain that medication to the patient, get it delivered, and that is the end of the process. Now, there are caveats. If the patient is uninsured or for whatever reason we've reached our final steps with a second level appeal being denied, there are patient assistance programs that we are able to help patients get their medications. We have a AI software that flags the drug on these treatment plans that alerts us to whether or not there is manufacturer payment assistance. Like I mentioned, the bridge therapy to make sure that the patients get started on their medication so there's no delay in therapy. And I think I've covered everything. The patient assistance team is with us, so I'm sure there are things that they can add to that I didn't touch on.
Yeah, please feel free. Diamond, do you have anything that you want to add to the process?
Yeah, I can add on to that. So most of the time, the problem starts for patients when the prior authorization has been denied or it's approved and the copay is high. But just going back to a prior authorization, once it is denied, our team works with the pharmacist and the provider to try and see if we can appeal or start what is a first level appeal. What most patients don't know is most of the time they are basically notified that that drug, that prior authorization has been denied first, and they do have the right to initiate that appeal. But if the patient does not choose to, because that is drug of choice, and it happens a lot, to mention in the oncology setting, that the drug is prescribed for what the insurance believes is off-label, but our providers believe that this is the treatment for this patient. And they can back that up with medical letters of medical necessity. They can back it up with clinical studies. And so they kind of work with our pharmacist. Jennifer's, one of those that we kind of, bring in to help with that as well. They can work with them to complete or come up with all this information the insurance is needing to appeal this decision, or even conduct what's called a peer-to-peer, which is a clinician talking to another clinician, stating why it's necessary for this patient, for their particular issue, to be on that medication. So there are different avenues, I should say, that can be taken.
Dealing with insurance companies is incredibly complicated. I mean, it's complicated if you break your arm, let alone if you're diagnosed with cancer and you're looking at, years, hopefully, of treatment and therapy. And I guess my next question is, how long does this process take, and what types of, stepping outside of like this bridge therapy option, but what sort of delays to treatment are we really looking at in some cases?
So the prior authorization can take 3 to 5 days. The appeal process can take up to 30 days to get approved. That's why they kind of jump in and help out with the bridge therapy. And pharma is great in offering us those options. Now, there are times when a prior authorization gets approved and a patient is ready to go, and it makes its way all the way through the system, and it comes to the pharmacist at the end, and we assess it. We check for organ dysfunction, we do drug-drug interactions, we assess it for clinical appropriateness, and we may hit a block in the road. So an example of this, because we deal with all types of cancer and all types of oral therapy, is one for prostate cancer, which is Orgovix. A prescriber had sent in a medication called Orgovix and another one called Erliata. Now, those two interact with one another. They're both used for prostate cancer, but they have an interaction. Now, when the prior authorization was submitted, it was submitted for whatever the prescriber had sent in with that Orgovix, which was 120 milligrams, 30 tablets for 30 days. Once it made its way through the system, the prior auth was done, everything was done, and it was ready to go, zero copayment. We found out that there was that drug-drug interaction, which required that Orgovix to be double the amount that it actually was. So because that interaction brought down that bioavailability, now we needed to go back and ask for a reauthorization from the insurance company for 60 tablets for 30 days. And of course, the insurance company gave us that block in the road because of the FDA approval. So we have to go through, we have to find the FDA approval on that specific drug-drug interaction. We have to cite studies that prove that this bioavailability does come down because of this interaction. And we have to present all of that to the insurance companies. And most of this has to be done with several hours on the phone, kind of explaining, faxing, sending them all this information. With this specific patient, we had to cite FDA, NCCN guidelines, all of that. We ended up getting it approved, but it took several hours of the day to make sure that they understood that the reason why we had to come up on this therapy wasn't for, convenience reasons. It was like medically necessary due to that drug-drug interaction. So there are several caveats with this, and this is a really close relationship between our med access specialists and our pharmacists and our providers that all kind of have to come together and make this magic happen. So it can make its way all the way through the process, but these caveats can still happen.
Yeah. Just hearing you talk through it, and my head spinning in multiple different directions, right? Because it is so incredibly complicated. And I think, again, I know I keep tooting this horn, but the fact that, Memorial Healthcare System has this type of a program in place to do all of this work for the person who needs the medication is incredible. But we also know that the type of program and medication access program specifically that you all are able to provide to the people who are seen at Memorial does not necessarily exist in all places across the country where people are being seen. So is there, I guess my first question, and Claudia, I'll go to you for this, is how does someone find out if the center that the care facility they're being seen at might have someone, even if it's not a team, but someone like you all to help navigate this process?
The first step would be consulting with the treatment team. If I were a patient, I would ask my treatment team. This could include social workers, the physician themselves, patient navigators. A lot of those people have the knowledge to guide the patient in the right direction. I would start there. A lot of the time, our pharmacists are privy to this information to assist the patient. I would say the best thing a patient can do from the get-go, besides speaking with their treatment team, is doing a lot of the research. This information, a lot of our patients they're not aware that they have access to this information online. Like, they can go and they can find this information online. I have patients who have filled out applications for themselves that they find online just from doing a little bit of research. And I name the name of that drug, and you'll see that there are so many websites that offer information as far as getting the free drug, getting the grant, getting a copay card. I always encourage patients, if you are able, or if your family is able to help, to go and do that research. But start from the very beginning. It starts with consulting the treatment team. Ask the treatment team, and they more than likely are able to guide you in the right direction.
Yeah, it's interesting because, when I think about this, like from my own personal experience, obviously not with a cancer diagnosis, but just trying to go online to determine whether or not a healthcare provider takes my insurance has proven to be a challenge, right? Even for me. So I can't imagine, trying to do this research on your own as someone diagnosed. Obviously, a care partner or a care provider can be helpful in that. But I know, like I said, sometimes it's even a challenge just to find out if Dr. X, Y, or Z takes the type of insurance you might have. So that can also be incredibly frustrating and disheartening, I guess, for folks living with, or especially early on. So if there's not one, we've already talked about patients can do this sort of research. And Diamond, can patients or caregivers, complete patient assistance or financial support applications on their own? If the answer is yes, how do they know where to go to do that?
Absolutely. So the most apparent way to complete those applications, whether they're online, or if it just simply involves, because everybody finds information differently, simply just contacting the manufacturer. A lot of the time, depending on, a series of questions that maybe that rep at that manufacturing company will take the patient through, it leads them to aiding the patient in the right direction, letting them know, well, maybe you'll need to take the direction of being enrolled in a foundation because you have Medicare first, or maybe we can enroll you in a free drug assistance program because it looks like you're uninsured. So I'd recommend by first starting with the manufacturer for that reason.
Yeah, and I think it's important that, that we get the message out there that there are programs, there are nonprofits, there are drug companies who offer assistance programs, because I don't think there's a general awareness that any of these programs even exist. So that's why, I can imagine, again, like, where do I even begin my search? What do I type into Google to find out whether or not something like this exists,
Right.
For me? So who specifically are we thinking that patients or caregivers, more likely could or should contact if their healthcare team does not have anyone available to provide this type of access or information? Like, specifically, I guess that's, what is the Google search?
Yeah, so piggybacking off of what Diamond said, if you find out the name of your therapy and you plug that in and the manufacturer comes up, let's say it's Pfizer, when you click on that drug, it'll take you to the website. Any 1-800 number will get you in contact with someone, and you can actually speak with someone that will get you with a field reimbursement specialist, someone that's local, that's able to assist. A lot of the time, they offer those patient navigation services free of charge. They offer a lot of services actually free of charge to help that patient now that they've been prescribed one of their medications. So if the facility doesn't have any access to that and the patient is kind of at a standstill or stalemate, they can plug in the name of the drug and probably just put in the name of the drug and assistance. And it'll take them to, more than likely, the search engine will come up with the name, the website for the drug. Call that 1-800 number on the website, and we'll always happy to help that they need. Sometimes the patient may not even need assistance, but with the cost of the medication, but they need to speak to someone.
And what I want to reiterate here, because I also know that quite often patients don't know the name of the drug, let alone who made it. So it's, I think, a key point to take home in the event this happens to you is to find out what the name of the drug is, figure out how to spell it, because that can also be really challenging, right? Write it down, and then do a search to ask who makes it, because you're absolutely right. There are, the pharmaceutical companies and the drug companies out there, more often than not, have assist programs, and they have people on their teams who will help determine whether or not you qualify, whether it's a copay assist or anything other financially sort of related to that. And I think a lot of people don't know that, and I will do a not so shameless plug for GoTo and say that that's one of the services that we provide on a national level to the people who call us who are having challenges. We have very similar lists to what this. We don't necessarily case manage in the way that they do and do the work for you, but we can help to point you in the right direction so you have a better chance of gaining access to the drug. So we talked a little bit about appealing insurance denials. We, at a high level, said, okay, yes, patients and caregivers themselves can appeal an insurance denial. Can you walk us through what somebody could expect or what that might look like? Like what do I need to do if I want to say, okay, I'm challenging XYZ insurance company based on this denial? Is there a specific number, I guess, that I call?
Well, most of the time for the appeal process, once you get a denial letter from the insurance, it'll usually tell you the process on how to appeal the decision, whether it's by phone, by fax, or on some cases online also. But it's always in the denial letter. Patients can submit that on their own, or they can notify their provider's office to say, hey, it's been denied, can you assist with this? Just notifying and speaking with your provider can help move forward with that process, because then they themselves can work on the appeal process, or they can reach out to pharmacists like Jennifer who can help with the appeal process.
Yeah, and I think I'm kind of smiling right now because a story from a long time ago, and it was a woman who was diagnosed, and she used to live out here in California, and she has since moved to Arizona. But she was, this was probably, 10, 12 years ago, probably. And hopefully she still watches, and I know she's doing well, but insurance approved. She was going in for radiation therapy, and her insurance company, a big name insurance company, had approved placement of what are called fiducial markers. So the pulmonologist went in, dropped these little markers directly into her tumor to help guide the radiation therapy to, to the exact spots within the tumor. But then the insurance company denied the radiation therapy. So they approved placement of these markers and then denied the therapy. Well, she was a real firecracker, and she got on the phone and did not stop until she got the CEO of this insurance company on the phone. And you betcha they very quickly approved her radiation therapy. But, she was, from a lived experience, like, this is insane. But I guess if we look at the flip side of that, and Jennifer, I think it was you that was talking about sort of needing to plead and or prove your case. You need to show the research and and let the insurance companies know this is why. We aren't just pulling this out of our hat. There's actually evidence, based information that we can share with you to show why this is a thing. And I guess, and I'm sort of saying this as I'm thinking it, but in this complex place of cancer treatment now, particularly around this personalized or precision medicine, this gets even more complicated from an approvals standpoint, right? Especially as, if we're using something sort of off-label as an N of one, right? Because Dr. So-and-so said this really worked for him, and so we want to try this over here. It becomes even more complicated and more, more important, albeit burdensome for people diagnosed and their caregivers to have to know as much as they have to know, right? It shouldn't have to be this hard, but we know that people who do activate around their diagnosis, who have the ability to go out and educate themselves on what is best for them and their diagnosis, have better outcomes. And that includes not only when denial is not an issue, but when denials are an issue, and what steps to take to gain access to these life-saving, like I said, medications as quickly as possible. What's one thing patients can do early in their diagnosis to improve access to these medications? What's one thing that they can do? Patients or their caregivers?
I think one main thing is that they can speak to their providers, ask questions. What is my treatment? And then once try to follow through that whole process, speak with your insurance company if you're able to see is the medication on formulary, or speak with your pharmacy. It's honestly the faster route to see if the medication is covered or not. Once you're not, if it's not, then it's best to notify the provider's office so that they can see if maybe they want to change the treatment or if they're willing to go through the prior authorization process. So it's honestly more important for the patient to just ask questions from the very beginning. What's my treatment? What pharmacy am I going to? So it's mainly patient has to be an advocate for themselves. That's the main thing, if anything, when they first being diagnosed. Look into everything. Google. Yeah. Ask the doctor's office, the whole staff.
And you guys are obviously, very experienced, but we just heard, a little phrase on formulary. And people don't know what that means. I mean, a lot of these people have never, spent a day in the hospital, or, the strongest medication they've been on is an antibiotic. So what do we mean when we say on formulary, and why is that important?
So I'll take that one. So when we say on formulary, I think the most quite apparent thing for a patient to do is get a copy of that treatment plan. Call the insurance. If you call your insurance, that's probably the best way to start. Find out if that drug that's on that treatment plan is included on your plan. That's what we mean by formulary. Is it a part of the plan? Well, I have to try something first and fail that therapy before the insurance will possibly pay for what my doctor wants. So in my opinion, that is the best way to start. If you're continuing therapy, let's say you were put on that drug last year and your treatment plan is from, I don't know, December 2025, and it is still present, making sure that that plan that you choose will include that drug on the formulary or as a part of a paid on that plan. And, you can't really help all the time with the cost, but I think you could at least ensure that the drug is covered at the least.
Thank you. I think that covers the on formulary and what that means. Like I said, quite often, and again, this is just my experience over the last couple of decades with people being diagnosed and they're scared and they're getting all this stuff sort of thrown at them, and they don't know what anything means. These are all really big words, right? And so the sort of more granular we can get in the explanation about what this stuff means, obviously the folks at that are being seen at Memorial have access to you guys, so they don't need to know it. But a vast majority of people don't have access to specialists like you guys, and so they need to be educated on what's going on. I'm trying to be mindful of time. Last question before we jump into final thoughts. And I think this is a group effort, so whoever wants to kick it off and then whoever wants to add in. But what misconceptions about medication access would you like to clarify for patients and caregivers?
Oftentimes, a patient thinks that the first answer that they get is the final answer. So oftentimes that's, hey, high copay, this is what you have to pay, there's a denial, and they think that's the end of the road. That's not the end of the road. There are resources out there. For us here at Memorial, we are your resource. But outside of us, if you were doing this on your own, there are resources out there. Don't just get an infusion, for example, and get slapped with a bill and think, oh man, this is a $2,000 bill. I don't want to go to collections. What am I going to do with this? There are resources. You can contact the financial department at whatever treatment facility. Do you have help available for me? Are there any grants for this? Maybe just Google your diagnosis along with the grant. Lung cancer grants, lung cancer assistance. Don't take that first answer for the final answer, because that's where despair comes in and that's where hopelessness comes in. So that's a big misconception. For just a quick example, I had a patient who was given a therapy. It was an oral therapy. The copay was astronomical. That patient had land in the Dominican Republic. They wanted to sell to get that medication. I was like, wait, pump the brakes. Let's not do that yet. They actually ended up qualifying for free drug assistance. This was familiar. This was generational land that this patient was willing to sell to afford medication that was life-saving for them. That's scary. That's very scary. So there are resources available, and I always try to tell our patients, don't take that first answer for the final answer.
I love that. That's fantastic advice.
Yeah. Yeah.
Something else I want to add is that it's unfortunately the assistance is not always a quick process, whether the prior authorization has to go through so many levels of appeals, whether it's the going through the patient assistance portion, where it's a collaboration with the manufacturer, the patient, the provider. It's one thing that we try to push for, where you're advocating and you're on top of everything, because without the patient's consent and will to move things forward, we can't also move forward, because certain manufacturers require additional documentation, or they need the provider's signature for the prescription. It's something that some manufacturers are not going to be quick about it. They want 2 denials from the insurance, or they're okay with just 1 denial. It's something that we have to always emphasize, that it's not a quick process. Some manufacturers have a 30-day free trial card that we can use to, supplement, so that there's no delay in therapy. But that's one thing that I would say it's a big misconception of what's going on with medication access, that sometimes it's a quick process, and sometimes it's not. It's just something that we are trying our best to get that approved at the fastest as we can.
Yeah, I mean, I completely agree. These ladies are phenomenal in doing what they do. When it comes to med access, at least with us, there's an entire team behind them making sure that all the pieces of the puzzle fit together. And we continuously follow up with our patients. So whether it be the first time we're trying to get them access, and then throughout the life of the drug, like I had mentioned, there's always this reauthorization, new prior authorizations that have to get done, especially now in the month of January, where all these insurances have changed and we're all dealing with that wave. Just to know that a lot of these patients are now clutching, knowing that my insurance has changed, new prior authorizations are coming about. We are all proactively working on this, and we know that this is going to happen. So just having that really close bond, not only with your doctor, but with your pharmacist, with this med access team that calls and gets all this information from you, that's super important, being able to have that close relationship, because they're going to be fighting tooth and nail to make sure that you get these access to these medications, and that you're educated every step of the way what is happening to the medication.
Yeah. I honestly, again, I'm tooting the horn, but I really commend you guys. I mean, I've known and worked with people who have struggled and who have cut their dose in half to make their medication last a little bit longer, who have shared medications with fellow patients to try and kind of fill in some of the gaps between prescription renewals. And it's incredibly disheartening to me that these are, these people are desperate for access, and to know that you guys are providing that for them and fighting on behalf of them so that they don't have to, do things like that is just, man, it's just really, really incredible work. Okay, what do you guys most hope, and we can go round robin really quick, and Cynthia, I'm not picking favorites, I'm just going by where you're sitting on the screen. Cynthia, we can start with you. What do you most hope people take away from this conversation? If you had to pick one thing, what would that be?
I think the main thing is just, if there is a will, there is a way. Whether you're doing it for yourself, whether you're letting your provider know, or you're just doing an easy Google search on your medication, there is a way to always try to get your medication. It's just a matter of advocating for yourself and saying, hey, I need help. This is what's going on. And just making it known what problem you're going through.
Especially for our newly diagnosed patients, this is also overwhelming for them. I've worked with so many patients that they don't know what's the next move to make. Like Cynthia said, where there's a will, there's a way. There are resources out here to help you. At the end of the day, when you sit back and you think about it, even if you're making a lot of financially, you're making a lot of money, that you can really run through your funds trying to keep up with your treatments. There are resources out there for you. There are grants. There are manufacturer assistance programs. There is something out there to assist you. So don't give up. Don't say, I'll have to stop my therapy, or I'll have to change my therapy. Look to those resources. Try to find out with your treatment team if there's something out there to help you. There's hope out there for you. There are people like us out there to support you.
Diamond, how about you?
I just want to say, I think one of the best things a patient can do is, like I said, Claudia said, it's overwhelming, of course, when you're first diagnosed. Take a moment to take it in, and when you come back, try to understand you're prescribed this medication, you need to start. One of the best things you can do is be your advocate. Being your advocate, know what's going on, know about try to learn as much as you can, even if you're going to Google about the medication, what you might have to pay. Start there first. I would not take no for an answer. Rather, it is no, we're not going to cover it. No, the copay is unaffordable for me monthly. I would not stop. I literally would fight as if my life depended on it. So I think, like my girl said, if there is a will, there is a way. No, it's not the final, shouldn't be your final answer.
Love that.
Just based on everybody's testimonies tonight, like knowing that there is an entire team behind you, that you're not alone in any of this. Everybody is fighting and making sure that you are getting these medications and not delaying any kind of therapy. Knowing that there are doctors, pharmacists, med access specialists, all these people that come together and are talking and communicating about you on a daily basis to make sure that you get these medications as quickly and as safely as possible, and following up with you throughout that life of that prescription. The process might be slow and it might be grueling and there may be several barriers, but knowing that there are options, whether it be like they had mentioned, calling these companies, calling pharma, making sure that they're on top of it, making sure your pharmacy's on top of it, and even going to like pharmacies like Mark Cuban or Amazon at the end of the day if insurance is refusing to pay for it. There are options. Tonight's discussion is really about showing how all these access teams come together and they really make it happen for you one way or another, because the patients, our ultimate goal is to get that patient their medication at the end.
I love it. Thank you guys so much. I know how much I appreciate your willingness to come on and not just share with us, the work that you're doing within your community, but some tips and tricks for how folks can try and begin to navigate some of the challenges that they may be having. And I think one of the take homes for me, from a sort of pay it forward, type of place is the first answer is not the final answer. I think that's incredibly important, because I think it's real easy for people to go, well, they said no, so there we have it, right? So thank you all so much for coming and talking with us. Really, really, really appreciate it. A little bit of housekeeping up next. Gathering Hope, guys, is on February 9th, 11:30 a.m. Pacific. And our next lung cancer living room is on February 17th, so right after Valentine's Day. And we have Dr. Eric Singy from MD Anderson. He will be here live that night. He's flying out from Houston on his way to Targeted Therapies, which is in Southern California. So he's going to stop in here and have a conversation with us the night before. If anybody's on social media and you don't currently follow him on Instagram, he's the Lung Onc Doc. Incredibly insightful, helpful, really easy to understand, little bites of information. He's absolutely fantastic. So we're really excited to have him come. Again, a final thank you to our panelists, those of you in South Florida. I'm hoping to see some of you when we come out in June for our regional living room with Dr. Reyes and team. That's the 18th, Michelle? Yeah. So Michelle and I will be out there June 18th for our annual living room out there. So I really hope to see you guys there and participating. Everybody watching live, post live, Michelle's over there for managing and getting us all the information from the people and the logistics and all of that. And of course, talking to all the folks online, the entire GoTo team, Penn Media for coming in here, and then of course, our supporters. So AbbVie, Amgen, AstraZeneca, Bayer, Boehringer, Ingelheim, Bristol Myers Squibb, Foundation Medicine, Genentech, Johnson & Johnson, Merck, Novartis, Novocure, Regeneron, Revolution Medicine, Summit Therapeutics, and Takeda Oncology. Without their support, we wouldn't be able to bring this type of programming and other supportive and educational programs to you. So big thank you to them. Until next time. Let's have dessert out here, and thank you guys for staying up late and working out there. We really appreciate it, and we'll see everybody soon. Thanks, guys.
So I'll be brave if you're brave. I'll be brave, but only if you're